Hi students, this is Jamie Van Beek and welcome to PTA 110. I'm going to do this small podcast to tell you about our course. I'm going to be showing you pictures of students from last year just so you can get an idea, a visual idea of the things that you'll be learning in PTA 110 this summer. The first thing I want to talk about is the textbook, and there's a picture of it on the screen. It's called Mobility and Context, Principles of Patient Care Skills. This textbook is required. Along with the textbook comes a DVD. This DVD is very important because you're going to be putting it in your computer and watching little video clips of patient scenarios and different types of techniques. There are assignments in the course that are based on those videos where I'm requiring you to watch the video and then respond and answer some questions online inside our course. So if you want to get a used textbook, that's fine, but you need to make sure that you have that DVD because you won't be successful in the class without the textbook and the DVD. So that should be something that you should be already have or it's coming in the next few days so that you're ready. I'm going to give you just an overview of what you'll be learning this summer, and you can see through the pictures as well. You'll be learning about aseptic technique and hand washing, all very important as a healthcare provider, not only protecting you, but protecting your patients from the germs that are on your hand, especially as you're working in an acute care setting and you're working from patient to patient to patient on different floors of the hospital. It's important that you wash your hands so that you're not transferring germs from one patient to another. You'll also be learning about body mechanics. It's so important that you understand how to do proper body mechanics as a therapist because you are on your feet working, lifting, moving, helping patients all day long, and you need to protect your back. And so we'll be working in lab on what are proper body mechanics. You'll be working on bed mobility here. Misty, this is one of the students who's going to be graduating soon. She is showing you how to do a bridge, and so she's teaching the patient how to move their hips over in bed, and she's pretending that there's something wrong with the right lower extremity so that the patient has to keep it straight. It's important that we teach patients how to move in bed, whether they've had a stroke or a total hip replacement or they're debilitated, or they have a back injury. It's all important, and patients need to be taught that, and that's something that we'll be working with them. You're also going to be working on some range of motion, some basic stretching and strengthening type exercises that are done in the bed or on a mat table in more of an acute, subacute setting. And here you see she's kind of doing some stretching with the patient, stretching those, looks like she's stretching those hamstrings, and she's stretching up in the thigh. You'll learn about ankle pumps and heel slides, quad sets, glute sets, bridging, knee to chest, just some basic exercises that you can do with your patient. The key will be learning when you do the certain exercises for what type of patient. For instance, these things that she's showing right now would be contraindicated for someone who's had a total hip replacement. A total hip replacement is not allowed to do this much flexion in their hip and these movements. So you're going to have to learn which exercises go with which type of patient. You'll also be working with assistive devices. So how do you help a patient with a walker or a cane or crutches? A big part of this class is transfers. How do you help a patient to supine, to sitting on the side of the bed, and then from sitting on the side of the bed to getting in the wheelchair? You could do a stand-step pivot transfer. You could do a low pivot reach. You could do a transfer with an assistive device like a front wheel walker. You could also do a transfer with a slide board, and in a few seconds here you're going to see a picture of a transfer with a slide board. A slide board is a board that is used commonly with patients that have had a spinal cord injury, and this board helps them basically go from one surface to another by sliding across. This patient is unable to stand because they've had a spinal cord injury, and we're going to work with them on how we use this board. This board is also used for very deconditioned patients that are unable to stand, sometimes bariatric patients that are just too large for someone, a therapist, to move by themselves. We might use a slide board. These are all the things you're going to learn in this class. It's so it's a really fun class, and there's 3 of us teaching it to you. I myself am teaching through the computer. Patty is teaching the Bellingham Labs, and Di is teaching down south with the South Sounders. All 3 of us have worked together for a number of years in this class, and we work well together. I want you to know that we are all on the same page. We've done this course many times together, and we look forward to working with you. All 3 of us are PTAs who have a lot of experience in working with acute care, working with patients who are really ill. And also, how do you work with those patients once they progress and they're ready to go home or be discharged to a different floor? So the 3 of us are a great team, and I want you to know that you're in good hands and you're going to have a lot of fun learning. Whether you're up here in Bellingham or you're down south with Di, this is a very fun class because you've had the quarter of kinesiology and all that very hard pre-stuff that goes into the program, and now you get to have a little fun with some skills. So thank you for listening to the podcast. The last part here, there are always students who ask me these type of questions. How many assignments are in your course? Well, I've got 7 assignments total in PTA 110. We also have 3 written exams that happen on the lab weekends, and we have a final lab practical where you put it all together and you make a patient treatment. There are 4 due dates for this quarter, and you can see those 4 due dates and all of the assignments on the syllabus. They are all there for you to read and review and see, so you can get an idea of what's coming up. I open the information in chunks of material, I call it. So everything that you need to have read and looked over and watched the videos and the assignments that you've needed to complete is all open right before you come into lab. So for instance, if you go online in our course, you'll see that modules 1, 2, and 3 are open because that's the information you're responsible for the next 3 weeks. And you should be ready to come to lab and really work with that material. And so that's why I open it into chunks in this class so that you can kind of prioritize a little bit your time and what you need, and you'll be able to get a vision of what you need to know for the first lab weekend, the second lab weekend, and the final lab weekend. I really look forward to working with all of you. I am here. I am available to you. You can email me at any time, and I will get back to you. Excited to work with you guys.